Moments ago, President Trump signed an executive order meant to slash prescription drug prices in the United States, a 59% cut to costs touted on his social media. But then the president changed that number to nearly 80%. Listen.
Whatever the lowest price paid for a drug in other developed countries, that is the price that Americans will pay. And we're using the term other developed countries because there are some countries that need some additional help, and that's fine. I think that's very good. Some prescription drug and pharmaceutical prices will be reduced almost immediately by 50 to 80 to 90%. Big Pharma will either abide by this principle voluntarily or will use the power of the federal government to ensure that we are paying the same price as other countries. To accelerate these price restrictions and reductions, my administration will also cut out the middlemen. We're going to totally cut out the famous middlemen. Nobody knows who they are, middlemen. I've been hearing the term for 25 years, middlemen. I don't know who they are, but they're rich. That I can tell you. We're going to cut out the middlemen and facilitate the direct sale of drugs at the most favored nation price directly to the American citizen.
So let's bring in CBS News reporter Alex Tin for more on this. So what does this mean for consumers here in the United States? The president says he doesn't know who the middlemen are, but they're very rich. What does cutting them out do?
Yeah, so there's really two parts of this proposal we should be talking about. The first part is this new most favored nation idea, right? His whole argument is that you can essentially take the lowest price paid by another developed country and tell drug makers you should be charging that cost here. And what's interesting about this proposal is in order to do that, as you heard him say in that quote we just played, the president is saying if you don't agree voluntarily to charge this price to everyone, private insurance, public insurance, Medicare, Medicaid, what have you, then we will force this price upon you through regulation, probably through Medicare. So essentially he's using Medicare as a bargaining chip to lower drug prices for everybody. We'll see if that actually works. The other part of that proposal is obviously this new idea of cutting out the middlemen. That's something that's probably going to face a lot of pushback, not just from the insurance companies that support this system, but obviously courts, because it's not clear whether they have the authority to do that, although they're clearly going to try.